Hi, I'm Dr. Arshiya, practicing gynecologist from Bangalore. I have joined this hybrid FRM course from Medline Academics 9 months back, where online classes were conducted, and I've attended a clinical simulation program, and I've completed my clinical attachment. So regarding clinical attachment, we start our day presenting cases, variety of cases to Dr. Shantala, and we discuss each and every case in detail. Any furthermore doubts, we discuss with her, and we get to know most of the things. Then we go to OT, attend multiple cases like endoscopy, hysteroscopy cases, laparoscopy cases, and we saw multiple difficult variety of embryo transfer, OPU pickups. And later on, we attend OPDs along with Anu ma'am. We saw multiple variety of cases, and that also we discuss with both Anu ma'am and Shantala ma'am. Of the week, we attend Kamini ma'am OPDs, where we can see how she interacts with the patient, how she counsels the patient, how she gets to know most of the cases, and how she treats the patient. Like multiple IVFs were done outside, like variety of, they've been through variety of infertility clinic, and multiple IVF treatment they've given. And ultimately, it was a happy news to them that they conceived after coming here by a different protocol, and multiple steps were taken during their treatment. That was quite surprising. OPUs, what was done during these clinical attachment were like almost similar to our simulation training. So that was like we could correlate that, and in even difficult cases, we could see during our clinical attachment how OPUs were done, and we got to know about embryology lab in detail, how they process the semen. We saw through a microscope as well which cases require IVF, which cases require ICSI, and individualization of the protocols we could assess. At the last, thank you to Dr. Kamini ma'am and Medline Academics for providing such a wonderful course. Thank you.